Today, I want to talk to all of you about postpartum health and healing when it comes to your perineal area. One of the most common things I hear from women in general, but specifically postpartum, is the phrase, "No one ever told me that." And I don't want to ever hear another woman postpartum say that phrase again. And I'm talking for both C-section and a vaginal delivery. There are some things that you should be aware of. And after having worked as a postpartum nurse for many years here in Philadelphia, I am probably one of the few experts who at a young age saw this firsthand, having not experienced it myself yet. So I'm going to guide you through from the nursing perspective what's going to happen. One of the big no one ever told me's that I hear all the time in terms of postpartum health is no one ever told me that my vagina could tear. So yes, it can tear, and here is everything you need to know about what to expect. You are going to, if you're having a vaginal delivery, you are at potential risk of having a vaginal tear or a laceration. And there are 3 different degrees. There's a 1st-degree tear, a 2nd-degree tear, and a 3rd-degree tear. And your provider who's delivering you is going to look at the vaginal tear and classify that. The tear is going to happen between the vagina and then your anal opening. So you could have a 3rd-degree tear as something that could go almost the entire way. It's going to be very painful. You might not notice it immediately during the delivery process or immediately after delivery because there are a lot of things that are going on in your body, and hopefully you're welcoming your new baby in your arms. So it's a bit of an overwhelming experience. So the first time you go to the bathroom, we want to make sure that everything has stayed intact during the delivery process. If you're having a C-section, we're going to do the same thing for you as well when you're ready to come up and go to the bathroom and get out of bed the first time. You just are not going to be at risk for the vaginal tearing. But here's the thing, it's going to be incredibly uncomfortable the first time you get up to go to the bathroom. The nurse, this would have been me, is going to get you up and out of the bed, walk you over to the bathroom, help you sit on the toilet. It might feel extremely painful. You might feel like you want to cry or embarrassed by the fact that you have to pee in front of someone else. But just take solace in the fact that we're literally there to support you. We're not judging you at all, and we know that this is very painful and uncomfortable. Once we get you to sit down on the toilet to help you pee for the first time, ask the nurse, if she hasn't done this already, to turn the faucet on so the water is going to trickle down and help stimulate you to pee. And you're going to ask for, if it's not in the room already, you're going to want a little squirt bottle, a peri bottle. This is going to help sort of clean and wash the perineal area if there's been any blood, because you will be bleeding. And you're going to want to get a fresh new set of those mesh undies from your postpartum nurse, and you can have her layer it with pads. You can have her layer it with Tux pads, which are witch hazel pads. They feel incredibly soothing to that area. And one of my favorite tips and tricks is to ask for a baby diaper filled with ice. So you can actually break open the diaper, fill it with ice chips from the hospital, and then seal it up and wear that like a pad with the Tux pads right on top. No one ever told you that you would be bleeding for up to 6 weeks postpartum, even if you've had a C-section. Yes, you can still bleed if you've had a C-section, not just after having a vaginal delivery, and that's because your uterine lining has built up to support the pregnancy throughout the past 9+ months. So when you've had a C-section, that uterine lining still needs to shed, and it's going to come through the vaginal canal, and it's going to feel like a very heavy and often crampy and painful period because you've also just had a major abdominal surgery with a C-section. So just note that yes, you can experience bleeding vaginally after both C-section and a vaginal delivery, and that bleeding can last up to 6 weeks postpartum. And when your nurse or doctor or midwife, whoever's taking care of you, tells you to look for clots in your pad when you get up to pee, just make sure that we tell you the size of a golf ball, but I mean, how many of us are really paying attention to the size of a golf ball or a baseball? So if it's, you know, the size of your fist, slightly smaller, like the size of a doorknob handle, that's something that you can visualize a little bit better than a ball. You need to call your healthcare provider immediately because we worry about the size of that clot and potential for postpartum hemorrhage, which is bleeding. So it's normal to have a period flow. Watch out for clots. And if you're soaking through 1 full thick pad per hour or less, you also want to call your healthcare provider and get seen immediately. Lastly, no one ever told me what to bring home from the hospital or what to be armed with in terms of your perineal care postpartum. So let's walk through it. At the hospital, please ask your postpartum nurse to stock you up with a lot of that postpartum mesh underwear. You really shouldn't have to go buy that anywhere else. You can get that from the hospital. You've already paid for a lot of this stuff during your stay, so make sure you stock up on that underwear. Set aside some of your baby diapers for you to use as ice packs that are going to be comfortable to put in that underwear. Stock up on any of the thicker pads that they have at the hospital, or I recommend going out and actually buying organic cotton pads because that is going to be directly touching the perineal area. They can give you Tuck's witch hazel pads, which are going to be really soothing, which they should have given you again throughout your time at the hospital. And if you aren't able to get them through the hospital, you can honestly make your own. You can buy witch hazel at Whole Foods or Target or wherever you go to pick up your drugstore supplies and stock up on it. I like the Thayer's Rose Witch Hazel, and we can tag that here in this video for you so you know which brand we like. That's all that you want to keep at home in terms of your vaginal care postpartum. So pretty much all of this comes for free from the hospital except a couple of things. So don't feel like you have to go out and spend a ton of money on crazy kits or different stuff in terms of your vaginal care or peri care. And one more tip, the lovely sitz bath, they can be really helpful. So a great way to do a home sitz bath is fill up the bottom of your bathtub just with a little bit of, not too deep, but so that your perineal area is submerged in the bathtub. And you can do a sitz bath that way. You just want lukewarm water, and it helps soothe that inflamed area because your vagina is going to be very inflamed and sore for a while. So those are our tips for at-home perineal vaginal care and also what to expect in the hospital. For all of our postpartum bento mamas out there, or if you're using bento and you're pregnant, this video is for you. If you're interested in learning more about the postpartum experience and how to prepare for it, how to deal with things at home, please let us know, DM us on Instagram or email us anytime at info@mybento.com. And this is a great way for us to learn if you would like to have more webinars or a full course with educational material to get you set up for the postpartum stage. Our mission here at Bento is to empower you with education, and part of that is teaching all women about the postpartum experience. Don't forget, you can reach out to one of our care team providers at any time if you have questions, and we'll get you set up with your Bento for postpartum. And we can also give you great quick tips like this to help you prepare so that you don't feel so overwhelmed when you're at home with your new baby.